Hi, this is Rico Figliolini, host of Peachtree Corners Life. Before we get into our show, I just want to say thank you to our podcast sponsors. EV Remodeling Inc. is one of our sponsors. Eli, who owns that company, it's a huge company that does a lot of design to build, renovation work on homes, lives here in Peachtree Corners, has a great family. You should check them out. They've been a great supporter of ours. EVRemodelingInc.com is where you can find out more information. As well, Clearwave Fiber has been a supporter of ours, and they've worked here in Peachtree Corners providing internet services for 1,000 businesses here in the city of Peachtree Corners. You're going to want to check them out. They're not your typical cable company and internet provider. They're here locally, and they're committed to this community. So check them out, Clearwave Fiber. Now, to get to our guest today, CEO of Botanical Sciences, Gary Long, has joined us. Hey, Gary.
How you doing, Rico?
Good. You know, it's interesting. A friend of mine that owns Peachtree Pharmacy that I was talking to the other day about some stuff, and she said, you know, we're going to eventually be hopefully a dispensary for medicinal use marijuana, and because it's legal in the state for low dose THC to be sold here in the state for medical purposes on an approved list. And she said, you know, you should speak to Gary Long. Gary Long is the CEO of that company. And by the way, he is connected to Peachtree Corners too in a different way. So why don't you tell us a little bit about yourself, Gary, before we get into the company?
I'll do. And thank you for that. Yes, I actually grew up in Peachtree Corners in Spalding Corners on Spalding Drive.
Right.
Started living there, I think, when I was about 8. So it was 1977. And lived there till I went to college. I went to Auburn University and then returned for a little bit prior to kind of establishing my own, career in life in the Alpharetta area. So spent quite a bit of time there. I went to Norcross High School. I went to Peachtree Elementary School. So quite a bit of connection to the community.
For sure. And this was the old Norcross High School.
Yes, the old Norcross High School in Beaver Ruin.
Yes, that was still around when I moved here in '95, I think, before they built the new school. But now you're CEO of one of two companies in the state of Georgia, if I'm right, that do medicinal marijuana, Botanical Sciences, and which is founded by a physician. It's actually the only physician-founded company here. And just so that people know, the low THC oil it's not the active ingredient of marijuana. You're not going to be able to get high on this, correct?
No, actually, you can, but it's designed the way that the state kind of initiated the policy was having a lower THC content in the oil as a percentage of volume.
Okay.
Should not be used necessarily for the purposes of getting high, but there are benefits to patients depending upon what their treatment or their symptoms are.
Okay, so educate us a little bit about the product itself then, and where you are, and what's licensed, and what list of, not the entire list, but who can use this?
Okay, great. Yeah, it make sense for me to just kind of take people through a little bit of a history lesson about how we got here as a state. In 2015, the state passed Haley's Hope Act. So it's been 8+ years now that we've actually had a law in place in the state of Georgia where you've been able to possess low THC oil for the benefit of these medicinal conditions. Only in, I think in 2020 is when the state started the process to enable companies like ours to apply for and through an RFP process to be awarded a contract to be a supplier, a regulated supplier of these products. We were very, very fortunate and pleased the fact that of the 69 companies that were participating in the state's process, we were the highest ranked company. So as a result of that, on the tail end of their process in 2021, we were selected as the #1 company, and we received what's called a Class 1 license. And that license enables us to not only produce the product, but to process it into its usable form, to distribute it, and then to dispense it. What makes the state unique is not only are we dispensing it through our own dispensaries that we own, and there's 5 in the state right now, but also we're the only state in the country where independent pharmacies are allowed to dispense medicinal cannabis. and our Governor Kemp, just signed off on those rules, enabling uh, independent pharmacies to actually dispense the product, which we love being a physician-founded company
Right.
because everything we do puts the patient at the center of this clinical journey. And we know that pharmacists play a very important role in that process, right?
Yeah.
So not only do you get advice from your physician, you also get advice from your pharmacist oftentimes when you're being prescribed a medication. And so we see this as being an incredible opportunity for the patients of the state. And as you mentioned a moment ago, there's right now about 18 qualifying conditions.
Right.
And the things that qualify tend to be related to pain, cancer diagnosis, multiple sclerosis. So a lot of different neuromuscular diseases, PTSD, and anxiety disorders like that, sickle cell anemia. The list is on our website and it's also available online through the state's own websites.
Right. Right.
But quite a few conditions, and we anticipate that that list is going to expand.
Yeah, the list, I mean, just to give a few more, it's Alzheimer's disease, AIDS,
Yep.
intractable pain. It goes into autism, certain spectrums of it, above 18, Tourette syndrome, sickle cell anemia, Parkinson's, mitochondrial, Crohn's disease. So quite a few. Most
Yes.
of them, most of the commonality of that is though severe or end stage hospice care as well in that area. And so no doubt it would probably expand, I would imagine.
Yeah,
Things
there's
get
already been
moving.
discussion.
Yeah.
Yeah, I was gonna say there's
Uh,
already been some discussion with
yeah.
the state where they are planning on introducing other conditions to
Yeah.
the registry.
Which makes sense. I mean, government moves slow. God knows we know this. That's why it took 8 years, and then you
That's
have to
correct.
implement it, and that's what they did, right? In
That's
2020
correct.
is the implementation part. Um, there is a local pharmacy here in Peachtree Corners, Peachtree Pharmacy,
Yeah,
that is going to be applying to be one of the dispensaries for your company.
that's right.
Right? And they're a compounding pharmacy as well. So is that a common thing for the independent pharmacy?
Yes, there's quite a few just independently owned and
Yeah,
operated pharmacies,
yeah,
and some of them do compounding and some of them do not. But that
right.
is exactly the type of company that's allowed to dispense the product per the state.
And
And
that's
they're governed.
opening. Go
I was
ahead.
going to say one more thing. They're governed by the Georgia Board of Pharmacy
Right.
under the law, which is this Haley's Hope Act.
And that process of applying for that is happening, I think, in October, you said, or November?
That's correct, in October. So any independent pharmacy that is interested is allowed to apply through the Georgia Board of Pharmacy.
Okay. So eventually, maybe about the new year, I don't know how long the application process takes.
Actually, it might actually be in October because
Really?
in
Okay.
conversations with the governing body, which is the Georgia Board of Pharmacy,
Hmm.
and the Georgia Department of Drugs and Narcotics, who is the law enforcement agency that assists the Georgia Board of Pharmacy,
Right.
they said that they will turn around the application process within a couple weeks.
Really?
So we're anticipating
Okay.
seeing some, our products in the independent pharmacies in October.
Wow. Okay. That's tremendously fast for the state
Yes.
government to be working.
Yeah.
So check that out. Peachtree Pharmacy is where you should probably go in the
Yes.
city of Peachtree Corners. Um, the other thing is, I don't use it. I know I have a lot of friends that use CBD oils.
Yeah.
CBD stores have popped up. Not just stores, but anyone that has a store can sell CBD oil.
That's right.
So give us a little understanding, Gary. What's the difference? And yeah,
Yeah.
tell us what the difference on that is.
Great question, and I'm sure there's a ton of confusion
Yeah.
because everybody I talk to kind of thinks one is the same as the other, and they're really two different things. Um, the industry of CBD oils and those types of things, they have a lot of medicinal uses, right?
Hmm.
There was a bill that was introduced by the federal government in 2018 called the Farm Bill, and the Farm Bill enabled companies to farm hemp, which has been around for thousands of years. And hemp is a sister plant to the marijuana plant. They're
Right.
virtually identical in many ways. But the law says the Farm Bill says that you can only derive 0.3% THC from a hemp plant. And so that's a problem, but it's also a loophole. So what
Mm.
many companies have done is they've taken that little loophole and now they've built a whole industry around this. but on its own, that's not a problem. But the issue is, and I think your listeners have probably seen it with their own eyes, is it's proliferated all over the place. It's in
Oh
convenience
yeah.
stores, it's in these pop-up dispensaries. And what's happening is there's absolutely no regulation whatsoever on the quality, the purity, the labeling of those products. And what's happening, unfortunately, in our state, Rico, is many of those products contain heavy metals, they
Mhm.
contain solvents, they contain microbials. Um, they're being shipped in from other states who have already outlawed them. So we've become a dumping ground as a state, and that's a
Right.
very bad thing for the patients, right?
Yeah.
And so while there are still some legitimate companies out there who are selling products, it's kind of hard to find them in this crazy environment that's been created. So our store and our products are the complete antithesis of that, right?
Hmm.
We are 100% governed by the state. Everything is
Right.
laboratory tested, organic, no pesticides, no solvents, no microbials. So the products that they're getting from us, not only will they know are pure and safe, but they're Georgia grown on top of it. So we are a Georgia-based company. We manufacture everything in the state of Georgia, and so people can take comfort in that.
You have 460 acres in Glenville, Georgia, I think.
Yes.
Right.
Yeah.
Your facility is like 130,000, 133,000 square feet out
Yeah.
there.
It's big. It's a
Unbelievable.
state of the art facility. We built it from the ground up to support the needs of the state.
Yeah.
And so as more and more patients get added to the registry
Right.
through having conversations with their doctor, we're going to be able to service, as many patients as the state presents with.
So let me ask you on the CBD oil side, yes, I mean, everywhere I go, I mean, you could be at a gas station and see CBD oils.
Yeah.
I'm working with an Italian company doing an introduction of supplemental vitamins here in the States. And, they certify themselves their vitamins. It's a second certification here when it arrives in the States. I mean, vitamins are something we all ingest. And God knows, if you go to Whole Foods, there's a whole aisle. You don't even know which stuff to take. But it's regulated to some degree. The label's regulated, everything's regulated on that. And you're right,
Correct.
CBD oil is like the Wild West.
It
There's
is the
nothing
Wild West.
there. Yeah, and you don't even know. There's no chain of custody.
Nope.
You don't know what you're ingesting. You're right, like heavy metals. I mean, all that stuff. The unnatural, maybe the way it was even produced.
That's right.
I mean, it's amazing that people will take that
I
and
know.
not understand where it's come from and think it's okay.
You're right. It's very concerning that in the 21st century, in our sophisticated society, with the Federal Drug Administration and all of the government regulation oversight, that they would allow this to occur.
Right,
Just so your listeners know, 19 states have outlawed or regulated these synthetically modified hemp-derived Delta 8, Delta 9, Delta 10,
right,
THCA
right,
products that are all coming from hemp. Now, I'm not trying to throw a wet blanket on the entire industry. Like I said, there are some quality companies who sell those products, but the problem is that there is no control and regulation over it federally,
right.
and nothing in our state. And so it's kind of
No
like
way. Yeah,
take them at your own risk, I guess.
yeah. Interesting. The fact that you can put that there's infused products. I think even with
Yes,
and that's not for this.
drinks and foods, and yeah, no, our products are they're clinically formulated.
Yeah,
We actually provide them in the form of tinctures, which are sublingual drops,
right.
capsules, topicals like creams and lotions. We'll be introducing some lozenges, some other types of mix-ins, so that
Hmm.
people have a variety of ways to actually get the benefits from the product.
Right, right,
And everything we do, by the way, is controlled by the state. So we have to go to the state and have a conversation about, number one, the type of way in which we want to sell a product.
hmm,
Everything we do is tracked and measured by the state. So it's very, very regulated, and that's a good thing for the patients of the state.
for sure. Anyone doing this should be comfortable and understand that there is safety measures in place,
That's
and
right.
that anyone that sells this is all following the same guidelines. Whereas
Yeah.
like I said, the CBD oil. There are good companies out there, but because
Yeah.
it's a wild west, there's bad players as well.
Right.
Um,
And, there's another thing too that we haven't really touched on in addition is there are people, and this is the way it's been for years up until recently, that have needed or wanted the benefits from medicinal cannabis and have actually
mhm,
been buying that product on the illicit market, right? So
right.
they've been finding a drug dealer and buying those products
That's
from
right.
them without knowing what's in it. And I know there's a lot of growing concern in the community of people that have been doing that, that a lot of these products are laced with fentanyl.
Mhm,
And everybody knows the scourge of fentanyl in our country.
right.
So I think, again, this is going to push people to a regulated, controlled market in a good way, right? So if you need these products and want these products for whatever the medicinal benefit is that you are requiring, you can take comfort in knowing that what we're going to be providing and selling through these independent pharmacies and our own dispensaries are highest, purest quality products available.
And so then people understand it's a product that, because it's regulated like that also,
Yeah,
that people can legally purchase only up to 20 fluid ounces of the cannabis
right.
oil.
That's right.
And actually, it's not just purchase, it's, if I remember correctly, it's keeping up to 20 fluid ounces at any given time.
That's right. The law states specifically that an individual is allowed to possess up to 20 fluid ounces of this low THC oil at any one point in time.
Mm-hmm.
That is a law that was created back in 2015. At that time, they just didn't want to, put mothers of children who were needing these products to
Right.
be, put in a very bad legal situation. So 20 fluid ounces is a pretty big amount of this
Yeah.
product, as you imagine.
Yeah.
The average individual will consume 10 milligrams, 5 to 10 milligrams at a time. So 20 fluid ounces is a massive amount of product. So I don't think there's going to be any issues with folks feeling like they're going to be, in a bad situation with law enforcement.
Mm-hmm.
I imagine very few people, if any, are going to actually possess 20 fluid ounces at any point in time.
Because I mean, that 20 fluid ounces would normally last a long,
I mean, it a long, long time. It
okay,
really depends on the treatment protocol,
right.
of how much they're going to be needing to take. Some of these conditions that you and I referenced earlier,
Mm-hmm.
the neuromuscular ones especially require a very high concentration of the product in order to reduce the symptoms like spasticity. Actually, there's studies out there, many studies out there where it talks about it actually retards the growth of some or the progression of some of these diseases.
Okay.
Um, it's amazing, and that's really what I'm hopeful for our country and our state is that we will bring forward a lot of the education to the patients of the community,
Mm-hmm.
because there is a lot of information out there. But now that this is becoming more commonplace, right? I think
Right.
everybody's aware that it exists and it's out there. Is that now there'll be more studies, double-blind studies that can prove the efficacy of some of these therapies.
Mm. Okay. True. I mean, unfortunately, when it was illegal, no one cared to do that.
Nobody cared to do that.
Right. So, okay. So people can buy this oil, THC oil. In the state of Georgia, at least, can't be inhaled or vaped or
Correct.
smoked. Those are the things that are banned from use.
That's correct.
But so the company sells a product in 4 or 3 capacities, right? Tincture, if I remember correctly, is one.
Right. Yep.
Right. Explain to me how that's used, for example,
Yeah.
of the product.
So in healthcare, tinctures are used frequently for the ingestion of certain types of medicines. Essentially, it's like an eyedropper that
Mm-hmm.
has a measured amount on the vial itself, where a patient would take a certain amount of the oil measured to a certain place and apply it under your tongue.
Okay.
Um, that's what sublingual means. And there's an entry point under your tongue where it goes directly into your bloodstream. So you get a very quick effect where it doesn't have to go through your digestive system. When you take a pill or some other type of
Right.
consumed product, it has to go through your digestive system and the wall of your stomach and sometimes through your intestines before you get the impact. So
Okay.
this is a very effective way of getting the product into the bloodstream and to actually start to get the benefit. But there are folks who, want to consume a pill. That's why
Okay.
we sell capsules. And then the lotions and creams, the topicals we call them, are
Right.
really for external use, right? You put it on your arm or your
Hmm.
shoulder, and similar to how CBD products are used in that same way, these have a similar type of effect. I would argue a better effect because bringing the molecules of THC from medical cannabis and CBD together creates something called the entourage effect. And it actually enhances the ability for both compounds to have a positive impact on your body. If you take one or the other, you still get some benefit, but combined, it's a better benefit for whatever you're trying to solve for.
What challenges are you finding right now as a company in the state of Georgia getting this product
Yeah,
out?
it's that is a loaded question. There is a ton of challenges. The good news is our state is helping us try to address them. I would say the number one challenge, Rico, is awareness. Um, we've only been authorized to kind of start manufacturing and selling products since the beginning of this year. And there's not been a great deal of information coming from the state about the availability of these products. It's only been left up to us and another company to do our own marketing and communications and those types of things. So I think that is going to change in the near future, especially when independent pharmacies are going to be authorized to dispense these products, right?
Sure.
By default, there's several hundred independent pharmacies in our state. So it's going to literally go from very little access to statewide access overnight.
Well,
And so you'll be seeing a lot more information. So access and information is are two very important things that have been challenges. The other challenges really relate to a lot of what's going on at the federal level. I mean, if you're paying attention or you're reading newspapers, right now there's 40 of our 50 states have either an adult recreational use legalization. I think 24 of them are actually
right.
recreational legal, and the remainder 16 are like us, medicinally focused. So there's only 10 states that are left who don't have these laws, and because we still live with antiquated federal laws, in my
Mm.
opinion, which we are not allowed to operate like a normal business would, where you can write off certain things on taxes and those types of things. There's lots of prohibitions federally still. But the good news is, and there was some recent news in the last couple of weeks, Rico, where the Department of Health and Human Services, which is the largest part of the federal government,
Hmm.
issued a statement and a position to the DEA to reschedule marijuana to go from a Schedule 1 to a Schedule 3. And so that vote is going to happen this year. So that's a big
Mm.
change. If that passes, that's going to change the entire landscape of the country.
So what does that do, changing it to Schedule 3? What's the practicality of that?
Yeah, great. That's a great follow on. Today, I think your listeners would be surprised if they don't know this, that marijuana, according to the federal government and the DEA,
Hmm.
is equivalent to heroin,
Right. As a
is
Schedule 1.
equivalent.
Right.
Yeah, it's equivalent to fentanyl. So these incredibly potent drugs that if you take just a little too much will kill
Yeah.
you.
Hmm.
So I think that's what I mean when I say antiquated. Those were, ideas from the past. And so there is
Sure.
a lot of movement at the federal level now to actually change that and make it right. And in addition to the rescheduling, is what they're calling it, it's a rescheduling going from a Schedule 1 to a Schedule 3. There's also something called the Safer Banking Act, which
Mm.
would allow companies like ourselves and other companies who operate in this industry around the country to have access to the normal banking system.
Okay.
Because it is considered to be like a prohibition
Right.
federally, I can't put my money into a bank like a normal business today.
So how do you do
Uh,
that? How do you
it's
operate?
it is incredibly difficult to try to navigate around this. There are ways to make it happen. We're not the only company who has to do this. There are hundreds
Sure.
of companies in our country, hundreds, if not thousands, who are doing the same thing we're doing. But the good news is, if it's legal in your state, then it all is
Right.
fine. But those are some major challenges for not just ourselves, but every other state in our country. And if you travel anywhere, you know that this is kind of like the trains left the station. This
Right.
is widely used everywhere else, and Georgia and a few other states in the South and the Midwest are the last ones to go.
Yeah, and we were talking about before also about because there's no national standards like an
Right.
FDA regulation, that every state pretty much has some of their own rules. So what you do here, you might not
Yep.
be able to sell in another state,
That is
even if
correct.
you're right, even if you're approved in another state. You might have
That is
to set up
correct.
a whole separate setup for that.
You got it. That is exactly right. It is, our authorization is just for the state of Georgia, and
Right.
no other company that operates in another state is allowed to sell their products in the state of Georgia either.
Hmm.
So eventually this may change where there will be interstate commerce and this is no longer a federal issue. But again, we'll have to, I'm not going to hold my breath that the federal government's going to do anything very quickly. But we're going to operate the business for the benefit of the citizens of the state of Georgia and focus on that. And if these other things change, so be it.
Okay.
But we're just excited about the opportunity in front of ourselves and obviously the patients of the state that have been seeking this.
Sure. So people that are listening to this maybe thinking, okay, I have that, I have one of those 18
Yep.
diseases or ailments, and I want to be able to get this. This
Yep.
is not really a script from a physician, or is
That's
it?
right.
It's
You are correct. It is not a prescription. The way that it works, and it's actually pretty simple,
mhm,
um, is you go see your physician or a telemedicine provider even. There are telemedicine companies that
okay,
do nothing but focus on this, but you can go to your family physician, your internist, whomever. And if you have one of these conditions or a symptom that relates to one of these conditions, you can then get them to provide what they call a recommendation to get
mhm,
your medicinal cannabis card. So the physician themselves needs to be linked to the state's Department of Public Health. And
okay,
essentially, they file an application on your behalf through the Department of Public Health that says that Rico is authorized and is recommended to receive medicinal cannabis card.
mhm,
That card is then processed by the Central Department of Public Health, and then it will go to the Gwinnett County Department of Public Health for you to pick up in about 10
pick
to
up,
14 days. Uh-huh.
okay,
They are
not
not
mail,
mailing these cards. They are not mailing these cards. It
okay,
is it is something that we're working with the Department of Public Health on. It's kind of
yeah,
mind-boggling that they don't mail it like your voter registration card or your driver's license, but
yeah,
yep, we're just trying to
okay,
work through the bureaucrocy a little bit,
yeah,
but I
yeah,
think there's receptivity to actually mailing them eventually. But today you would
okay,
have to go pick it up
yeah,
at one of the Department of Health locations in Gwinnett County. And then once you have that card, you are
right.
authorized to purchase the product either at one of our dispensaries or at the dispensary of your independent pharmacy.
So once you have that card, there's no renewal to that card. That card is it
Every 2 years.
every 2 years. Okay,
Yeah.
so
You just
every
have to
two
go back
years,
to your doctor.
okay, and get recertified or
Correct.
reapply. The
Correct.
reapplication, or I guess,
And the cards are $25. So there's a
okay,
$25 fee that goes to the
understood.
Department of Health
Okay,
to get the card. And the card looks very much like a driver's license. It's got your picture on it. It's got some just basic information about
right,
you as the individual on it.
okay.
And that's the card you have to present when you go to get the product either at a pharmacy or one of our dispensaries.
So I guess that begs me to ask: do you have to go in person to get that card set up, like the DMV, to get a
It's a great
photo?
question. Yes, you do get you can submit a photo.
Oh,
Um,
okay.
yeah, yeah. I thought you were going a different direction with
Oh,
the card itself, and that is like you can, if you're a caregiver of a patient, you can
mm,
also get a card. So there are some people, as you know, that are too ill or debilitated and can't
yeah.
go do all of this on their own. So
Uh-huh.
caregivers can get a card on behalf of a patient. So if you have an elderly parent
Okay.
or if you've got a child who has severe, disease, one of these qualifying conditions, the mother or the father
Hmm.
can get a card on behalf of their child, as an example.
So a custodian can get, or a guardian rather, can get
Correct.
or a parent can get something for their child.
That's right.
If I'm a caregiver um, my cousin or my mother, um, I would have power of attorney, or they would accept me as
Um,
a accepted caregiver.
yeah, and I don't think it goes quite as far as power of attorney,
Okay.
but in this situation, if you're a primary caregiver,
Uh-huh.
you are authorized to actually get a card to purchase product on behalf of a patient.
Okay.
But both individuals will have to, file essentially to get authorization from the state.
Okay, so that would like I'm just thinking broadly now. So there's retirement places,
Yes.
assisted places. Are they because they're caregivers in a broader way? Are they allowed to do that for their?
I really don't know the answer to that question. If a company who's operating on behalf of a patient is
Right.
authorized to do that, I don't. I'll have to get back to you with the specific answer on that because
Okay.
that hasn't come up, but I can see that coming up.
Yeah, I could see that coming up also because you have assisted living places with maybe 100, 200 people in it, and
Yeah,
they're caregivers. They have medical people on staff sometimes, depending on
sure,
what it is. So I could see that happening.
sure.
Right now, there's, I think, about 30,000 registered patients
That's
as of
correct.
the last month or two. And that grew from 13,000 back in 2015. And if
Yep.
some of the stats are correct or not, I don't know. There's 500 applicants that are on backlog right now. I'm sure that's going to get faster as things go.
Yeah. It already has. The Department of Health has worked out some of the bugs of their process, and so most people are getting their cards within 1 to 2 weeks now,
Okay.
which is a great
That's fast.
improvement.
Yeah, yeah.
Yeah, it's fast. And what's also exciting too is like the word is getting out. The numbers of people that are joining the registry is growing pretty rapidly.
Mhm.
I personally have made visits this week to several departments of health around the city,
Hmm.
around Atlanta,
Yeah,
and they're seeing a lot of people coming in to get their cards, and so we're actually engaging with them to make sure these folks have a lot of educational information going into this process because
sure.
there's a big gap, as you know, of information out there. There's a lot of misinformation about what this could is being
Right,
used for, the
right,
benefits and all that kind of thing.
right,
So we're trying to serve as that resource for the patients of the state of Georgia. There's a ton of information on our website at botanicalsciences.com.
right.
I would ask, if anybody has any questions, either contact me directly or go to our website and submit a question. We'll be happy to provide any answers we can to help folks.
Okay. I guess one other question maybe would be as well. I mean, lots of things are covered by medical insurance. Is this also covered by medical insurance?
It is not,
Okay,
and that is merely because of the federal stance on marijuana.
okay,
So if these things start to change, like I mentioned earlier, if it gets rescheduled, if banking regulation gets changed and it gets
right,
changed at a federal level, it's possible in the future that there will be some reimbursement from an insurance carrier. I would see this first going, having some reimbursement coming from the federal government, like through a Medicare or Medicaid type of a role,
right.
before a commercial payer would probably do it. But the good news is the products themselves are not that expensive in the scheme of things,
Mm,
especially in comparison to a lot of prescription drugs out there that
sure.
people are taking. And they have a lot safer profile in terms of, you compare taking medicinal cannabis to relieve pain versus an opioid, as an example.
Oh yeah.
Not only is it non-addictive medicinal cannabis, it's extremely inexpensive compared to those prescription medicines, which obviously are very addictive and actually alter the chemistry of your brain. In addition to benzos and those types of things that people take for, PTSD and other anxiety related conditions. So there's a
Sure.
whole host of benefits, and
Hmm.
roughly, Rico, anything from around $25 to around $100, depending upon what form factor they're going to take.
Right.
That's usually gets you, a 30-day supply.
Well, that's
So
not
it's
bad at all.
yeah, it's not bad at
Yeah.
all.
And that doesn't even, I mean, I know medications that people take for blood pressure, for other things. You have to make sure you get your liver checked,
Yes.
um, blood tests, blood panels to make sure that the side effects of those medicines can be harmful.
Hmm.
Sometimes more harmful than the benefit, but
That's right.
um, and that yeah. So it's a whole different world out there. So things are changing.
Yep.
Where do you expect to be in about 5 years with this? Where do you expect
Wow.
Virtue to be in 5 years with this?
Maybe I'd play a lottery ticket if I knew.
Yeah, right.
I would say based on, the movement that's happened in our country, right, over the
Yeah,
last few years. And, you have conservative states, relatively conservative states like Georgia now adopting it.
Yeah.
I would say you're going to see probably the more conservative states in the South stay medicinal cannabis and maybe not go to adult use just yet.
Okay.
Um, there's an apprehension to go into being able to provide smokable products and just have everybody walking around smoking marijuana.
Yeah.
Um, because if you go to some cities and states, that there's a lot of that. And so
Yeah.
I think our state will go slow but
Mhm.
methodical to opening this up to a broader audience of people,
Right.
especially as we start to see benefits, being documented and those types of things.
Yeah.
Um, I do believe federally there will be some changes in the next 12 to 24 months that will, make this actually, maybe it'll be federally legal in a
Mm.
few years. And if that changes, then everything I just said will go out the window, and then all of a sudden, it'll be like any other industry in our country,
Right.
where you can sell products, doesn't matter what state you're in. But right now, there's still so much variability between states on all of these things that
Yeah.
again, I'm not going to hold my breath that there's going to be some fundamental change, but if there is,
Yeah.
it'll rapidly change.
It's interesting what you said before about cities with recreational marijuana. My wife was up in New York a few months ago, and she was
Mhm.
staying at a Midtown hotel, and
Yep.
she could smell the marijuana from, I think, the seventh floor practically. Because when she went out, it was
Yeah.
like you said, everyone was smelling. You cannot walk a block without smelling the depth of it because it's legal up there,
Right.
and everyone was doing it. Which, when it's legal, that's what you do, I guess.
Yeah. Yeah.
But
Well,
very different.
again, I would say our state has learned the lessons of watching other states go through this process,
Mm,
right? In a couple of ways that are pretty interesting. One is a lot of other states will issue hundreds of licenses for people to grow product, for people to dispense product,
mhm,
hundreds of licenses. And it creates an oversupply of the product,
yeah.
and then it gets proliferated everywhere, right? So our state has taken a much more thoughtful approach, I would say.
Mhm,
There's two companies right now that have the ability to sell and dispense, us being one of them. And there's four more that may come online within a
right,
year, but
right.
that's it. And those companies are the only companies allowed to grow the product, produce products with the manufactured product, and then to dispense them. And I think that's a smart thing. We may get, frustrated at times because it goes
Mhm,
slow, but I would much rather go slow and get it right
yeah.
than just kind of like, have it be a free for all.
Yeah. No, I agree with you. I mean, control makes sense and
Yep.
regulation makes sense to be able
Yep.
to do that. So cool. This was great. I learned quite a bit.
Great. Glad to hear
Uh,
that.
yeah, and I think our listeners know more now because of listening to you.
Yeah.
And certainly, if they want to find out more information about your company, its products, uh, the tinctures, the capsules, the topicals, and how to get a card and what qualifies. Your website is very informative. I was just looking
Great.
at it before. And people
Great.
should go to botanicalsciences.com and they can
Correct.
find that. And even follow you on, I'm assuming you're on social media.
Yes, I
Or,
am. Yeah.
or
The company is, and I am. So yes, we're on all social platforms: LinkedIn, Facebook, Instagram,
excellent.
X. Mhm.
And so if they want to get in touch with you, they can just go to contact page or
Yes.
just
Correct.
reach out to you. And again, I want to let people know here in Peachtree Corners that Peachtree Pharmacy is actually going
Right.
to also be a dispensary once they apply, if it's accepted. And maybe in October, they may have real
Yeah.
products already
Very
there.
much. So we're very excited about the pharmacy getting it in Peachtree Corners. And again,
Yeah.
I'm being a homeboy from
Yes.
Peachtree Corners. I'm
Yeah.
super excited for the community. So
Yeah.
really looking forward to it.
Cool. I want to thank you for being with us, Gary. Stay with me for a second as we sign off, but thank you.
You're welcome. Thank you.
Everyone else, I appreciate you being with us. You want to learn more, there'll be notes, show notes, links to the website and other information that you may need, link to where to get the card. But of course, if you go to botanicalsciences.com, they have all that there as well. But I'll have it in the show notes. Feel free to check that. And if you have comments or questions, reach out to Gary. Put your comments in any of the places that this will appear, which will be Facebook and YouTube, or email me and I'll get that information out to you as well. But thank you for being with us.